So finding antibiotics cannot be underemphasized when we are basically surviving, right? So not only antibiotics, we also should stay focused. We cannot feel fatigued, hungry at the wrong time. So we found some blue and white capsules, which could mean amphetamines, which are adrenergic drugs, which are excitatory. So why do we need them? Especially in a situation like this, when we know that infected zombies are nearby, we cannot be tired, right? So probably that's why it's useful. So looking at Dina having a puking, vomiting feeling, so we can correlate this amphetamines with stimulation. It stimulates not only adrenaline, amphetamines also stimulate dopamine and serotonin. Now these two, along with acetylcholine and histamine and neurokinin, they act on nucleus tractus solitarius and area posterima in the medulla oblongata. There is a special zone called as the chemo trigger zone, which can lead to vomiting sensation. Now, vomiting sensation can also be seen when people consume alcohol. Now, dopamine is very important for this vomiting feeling. Now, when we are consuming alcohol, as we see a lot of beer bottles when we are exploring in the houses, right? So it's correlatable. So dopamine, along with important inhibitory neurotransmitter when we consume alcohol, is gamma aminobutyric acid. So that and serotonin, there is acetylcholine, there's opioid stimulation. All this can act when we consume alcohol. So there is an infected over here. So let's get it. Yes. So looking at this zombie, you can see a lot of blood caked in the head and inflamed skin, which is rough. And some of that infected blood has splattered on her face. So we can correlate with culture medium in microbiology, where blood agar is useful. Bacteria such as streptococci pyogens we have discussed. So they cause skin infection. So how do they cause them? There must be some enzymes that are secreted. When it penetrates the skin, it spreads infection through the subcutaneous tissues. So how it does that is by enzyme hyaluronidase. It can cut through connective tissue proteoglycan. We introduced the topic of proteoglycan in the previous episode, how it is useful. So when hyaluronidase cuts through the subcutaneous tissues, just imagine the amount of infection that can be spread. So when there is massive infection, it is called as cellulitis, which is really severe. So we need to stock up on more antibiotics. So here we are, there are 6 more antibiotics for us. So we can think about the incubation period of streptococcus pyogens, which is 1 to 2 days. So which strong antibiotic we will recommend is, say, 3rd generation cephalosporin. There is cefpodoxim proxetil, there is cefixim. They are twice daily dosing, but the disadvantage is they can cause alteration in the gut flora, which is beneficial for us for our health purpose. Okay, there is one more. So fighters generally undergo training. They are trained to focus on certain structures. So over here you see she's targeting in the abdomen, the left side, probably the thoracic abdomen, where there is a blood reservoir, a lymphoid organ which can, secrete concentrated red blood cells when it is stimulated, which can raise the hematocrit by 1 to 2%, which is the spleen. And also in the neck, she is targeting a large blood vessel, which is common carotid artery, that is supplying the head and the brain. In the moments of stress, the brain can also secrete a hormone through its pituitary gland, that is adrenocorticotropic hormone, which can stimulate the adrenal gland to secrete cortisol. So cortisol would raise the blood sugar level, much like the neurotransmitter adrenaline, which we spoke about earlier. So blood sugar level is raised. There is a lot of lipolysis, so fat is mobilized from the adipose tissue. So another neurotransmitter I would like to talk about over here, by observing the zombie, we see how it is twitching, restless, am I right? Also moving kind of rigid. We can say that zombies seem delirious. So that, what else can we observe in a zombie? So when we look at another zombie, it's not dressed adequately for standing in the snow. So probably they are emitting a lot of heat, probably hyperthermic. So these can be correlated with excess serotonin, serotonergic syndrome. Serotonin is important for mood regulation, temperature regulation, for our thinking capabilities, even for pain perception. So serotonin, along with the other neurotransmitters that are important for autonomic nervous system, that is acetylcholine, also adrenaline. So what synergistically how it acts is, along with acetylcholine, it can cause intestinal contraction, bronchoconstriction, platelet aggregation, and along with adrenaline, it can cause vasoconstriction. So how they act together? So there must be a common pathway. There is a major cell surface receptor protein, that is G protein receptor acting, that is GI, GS, GQ are the different subclasses. So we'll see about them when we discuss in the further episodes. Thank you for joining me today. I will see you in the next one.
There's gotta be a way in.